Welcome back. We're the Cribsiders. We are the pediatric medicine podcast. We interview leading experts in the fields to bring you clinical pearls, practice-changing knowledge, and answer lingering questions about core topics in pediatric medicine. And Justin, what are we recapping today?
That's right. Thanks for joining us. Today, we are talking about infant nutrition. We interviewed Dr. Joan Meat, who's a pediatrician, a dietitian, a certified lactation consultant. She's been chair of the American Academy of Pediatrics breastfeeding section, as well as lots of other expertise roles for breastfeeding. She gave us a lot of great pearls about feeding infants and babies.
And, my favorite pearl that came out of the episode was about the benefits of breastfeeding. So we know benefits of breastfeeding both benefit the mom and the baby. For the mom, we know that there's a decreased risk for diabetes, hypertension, breast and ovarian cancer, while for the baby, we have decreased risk for severe diarrhea, otitis media, obesity, lower respiratory tract infections. What did you get out of the episode, Justin?
Yeah, one of the things that I feel like I have always struggled with and residents always struggle with is about supplementation, specifically iron supplementation, vitamin D supplementation. And we talked about how breastfed, healthy term babies should receive iron supplementation at around 4 months. And that's because there's just a little less iron in breast milk. Fortified formula milk does have iron. But then the vitamin D supplementation should really start immediately for any breastfed infant. Anyone who's getting less than 34 ounces of fortified formula should just go ahead. You can start vitamin D right at the hospital or on discharge to help prevent rickets and other vitamin D deficiency.
Now, when you're feeding and you're thinking about solids, it's more than just like, are they 4 months, 6 months? Really, you can start feeding solids when they can sit upright, they have good head control, and they can push back food.
That's right. And I think that was a good pearl of really not just saying it's 4 months or 6 months, but these are the major milestones of when a kid is safe to start solid foods.
So I hope everyone checks out the episode. Where can they find us, Justin?
You can find us at thecribsiders.com. You can find us on any podcast app, whether it's Apple Podcasts, Google Play, or whatever favorite podcast you use. Just check out the Cribsiders. Thanks for joining.